And so I just want to welcome everyone and thank you for joining us this morning. I am Rob Hope. I'm the director of Rework the Bay, which is an initiative hosted by the San Francisco Foundation, has been for about 15 years now. It was formerly called the Bay Area Workforce Funders Collaborative. What Rework the Bay is essentially, it's an initiative that brings together funders with workforce development, economic development, and worker justice leaders to advance collective solutions for a diverse and equitable. There are three areas of our work that we focus on. The first is increasing the number of quality empowered jobs. The second is around increasing equitable access to those jobs. And the third is around increasing the availability of affordable supports that we all need to be successful at work. You know, as our context has shifted so rapidly now, you know, the framework before the COVID crisis, and now that we're seeing the impacts of the pandemic and the incredible economic crisis that's ensued afterwards, we really see this three-part framework as even more relevant and a way for all of us to think about what a just recovery could look like in the Bay Area that addresses a lot of the long-standing inequities that have created such great income and wealth disparities in our region. Today, we're really excited because we're going to get a lot of really rich information from Abby Snay, and you'll hear more about her in a second, about how the state is responding to the workforce challenges that have just been dropped on us and on our communities by the COVID pandemic. Before we turn it over to Abby, I did want to say that, so Rework the Bay, we're all about people. This is sort of what we lead with. And before I start, I wanted to just acknowledge that today is Administrative Professionals Day. This is a national day to celebrate the people who take care of the many details, big and small, that enable many of us, including me, I know, to do our work. And so I do encourage you, if you haven't, to take a few minutes today to thank the staff on your team who play those critical administrative functions. And to that end, while she does so much more than administrative work for Rework the Bay, there's no question that my colleague Kyla Tolentino is our team member who keeps our trains running on time. And so Kyla, I just want to thank you so much for all you do. And you know, none of this would be possible without you, but it's important to say. Now that I've sufficiently embarrassed the most important person on our team, I will move on to some more tedious details. And Kyla, if we can go to the Zoom info slide. So I know all of you are probably Zoom pros at this point, since I know we've been spending the majority of our days on this platform, but just to make sure we're on the same page, I'm going to run quickly through a few tips for how you can engage on this webinar. So you'll see at the bottom of your screen two symbols that are very important. The first is the Q&A box. This is where you can put any questions that you have for Abby as she's talking, and we'll be monitoring that. And we'll be interjecting with Abby and lifting up questions that people ask. As other people ask questions, you can also comment on those questions or upvote them if you also share that question, so we'll know that it's a particularly important one to address. And then there's also the chat box, and the chat box is more for sending messages to all panelists and attendees. You can also share resources as we go if you know of information that would be helpful to the group based on what the subject matter is being covered. Abby has said that she's open to questions along the way, and there's going to be a lot of information, and so we do encourage you to ask those questions as we go, and then we'll also try to reserve some time at the end. But I think because of the amount of information, it'd be great to ask questions as we go. So without further ado, Kyla, if you can advance the slide. I'm very excited to introduce to you all, I'm sure many of you already know her, but she's a colleague who's been a leader in the workforce development field in the Bay Area for many years. She recently transitioned to a big role in Governor Newsom's administration. So Abby Snay, Deputy Secretary of Future Work at the California Labor and Workforce Development Agency, was previously CEO of JVS since 1984, where she held all kinds of positions, including a frontline counselor providing job readiness and other services to participants, and worked her way up to the leadership role there. She's also a member of the State Workforce Development Board, the California State Rehabilitation Council, and a board member of the National Skills Coalition. And we're very happy to and excited to hear what Abby's going to share about the state's emerging response to the COVID crisis from a workforce development perspective. So I will let you take it away, Abby.
Okay, thank you, Rob. And thank you for the opportunity to fill you all in on what is truly a work in progress. And I can't see your faces, and I wish we were there together in person, but I know many of you from many years of working with you at JVS. And it's been an exciting time to join the Newsom administration and to be part of what I think is a truly noble and historic effort to respond to the pandemic, to respond to the accompanying economic crisis, and to do it in a way that really hews close to our values around equity and fairness and high road. What I thought I would do today, and Kaylee, you can you've got the next slide, is just really set some context on what the impact has been so far on the workforce, and talk to you about how the state, particularly the work that the labor agency is doing, is responding in three ways: income support, worker safety, some of the efforts we're doing around rapid reemployment, and then some of the future planning we're doing. And as Rob said, happy to pause for questions and make this as conversational as we can. So in terms of context and the impact on the workforce, this is as of last Friday, the 17th. We have lost almost 100,000 jobs in March alone. The vast majority of them are in leisure and hospitality, with just the economy being in a forced coma, with restaurants closing, with the tourist and hospitality industry just shutting right down, other services shutting down, and then construction halted. In March, the unemployment rose by 1.4 percentage points, and this was before the full impact of COVID-19 was really in effect. We will see many more in the April numbers. And since March 12th, over 3 million unemployment claims filed. And those are the people who are actually able to file the claims. I'll talk a little bit more about that later, but the demands on the UI system are completely unprecedented. And so there are many, many more people who lost their jobs who are either not eligible or haven't been able to get through. And again, only as of last Friday, the state has dispersed over $2 billion in unemployment funds. And so how are we responding? The most immediate and for right now, the most effective way we've been able to respond is direct income support for people who have lost their jobs. EDD went from between 2,000 and 3,000 unemployment claims a day to 100,000 claims a day, and have literally been working 24/7 to expand services. And that has included redeploying hundreds of EDD workers from other roles to get them working on UI, working with the state to pull back to bring back some state workers who are on leave, and there are conversations in the works that could be really great, which would be to do some very quick training for people who've lost their jobs to join the state's workforce and do some of the claims processing as well. What the labor agency, and I will really credit Undersecretary Stuart Knox for his vision on this. We had some of the federal dislocated worker rapid response dollars that had not yet been spent, and through some very careful conversations and negotiations with the Department of Labor, have okay to use these for supportive services, which can include some income support. So the local boards have gotten, the 10 million has been distributed around the state, and that supplements what people are getting on unemployment insurance. As of next week, the Federal Pandemic Unemployment Assistance, with the unfortunate acronym of PUA, starts, and this expands eligibility for people who are self-employed and for independent contractors. So these all help a lot. As you know, though, we have such striking needs for people in California who are not documented, who are not eligible for federal unemployment insurance. And so the state, my boss, Julie Sue, with partnership and support from many of you on the call, and there is certainly a need for more philanthropic support, has set up, with Governor Newsom and the rest of his team, the California Disaster Relief Fund for people who are undocumented. The state is putting in $75 million, another $50 million is coming from philanthropic sources, and this allows 150,000 undocumented adult Californians to receive $500 with a cap of $1,000 per household. I think what's also notable is that while these funds are being contracted through the state's Department of Social Services, they are going out through the community-based organizations who work most closely with communities of undocumented workers. And the CBOs will also be responsible for tracking progress. So again, I want to thank those funders on the call who have contributed, and again, we'll put out a request because I know there is a need for more for this. And then the second area of response, and this is one that I personally have been less connected to, has been around worker safety. I mean, this is, after all, a highly contagious virus, an epidemic, and protecting workers right now has been really just a critical priority for the labor agency. One of the biggest pushes has been to get out information sheets, fact sheets for workers on their rights, on safety, and to really invest in language outreach through videos, through social media for those essential workers who have to be on the job with in multiple languages, with an emphasis on outreach on those workers in industries that are deemed essential and that have high concentrations of immigrants and undocumented Californians. So that's been really important. There are a few executive orders that the governor made in partnership with the labor agency. It doesn't seem that we should need an executive order to increase health and safety standards so workers can actually go wash their hands every 30 minutes at food facilities. And you've probably heard about some of the outbreaks at grocery warehouses, and I'll talk about the workforce consequences of those in a minute. And there was also an executive order to give 2 weeks of supplemental paid sick leave to certain food sector workers if they are subject to a quarantine or isolation order or medical directive. And it's just great that we live in a state that already has had paid sick leave. Cal OSHA, one of the agencies under the umbrella of the labor agency, has been giving guidance to the grocery industry around physical distancing, disinfecting, not using reusable bags, and really importantly, the state released $100 million to support childcare, and this is through the Department of Social Services for essential infrastructure workers, including grocery workers and other vulnerable populations, for an additional 20,000 additional limited term childcare slots. And I will say that there's some early planning starting now on what it will take from a workplace safety perspective as we look towards opening up the economy, and we'll try to minimize the spread or resurgence of the virus once the economy reopens. I can pause, Rob, if there are any questions before I go on to some of the reemployment work we're doing.
No questions yet, Abby.
Okay. And so I am blessed to work with a brilliant visionary advocate, Julie Sue. And many of you probably know her for her former work as an immigrant rights and civil rights attorney. And really, as soon as the economy started crashing and it looked as if this was really going to reach monumental, the monumental impact it's having now, Julie wanted me to shift my role. I was originally hired to support the Future of Work Task Force to do longer term planning around kind of the impact of future of work and how the state's workforce system should be responding to that. But I moved very quickly into supporting the Cal Wins initiative. And this is California for working in a essential or and as necessary services. And so we formed a task force in mid-March. I think the first meeting was the 23rd of March. And as the state has been expanding and just managing this surge in essential services in response to the pandemic, I've really been tasked with finding hiring opportunities. So in many ways, this has become almost a recruitment role, working as a recruiter for those state agencies. And then I'll talk a little bit more about some of the private sector surge roles to figure out ways that we can connect some of the 3 million workers who've lost their jobs with this surge in essential services. I've been working in very close partnership with Tim Rainey, whom I know many of you know, the head of the California Workforce Development Board, labor partners, also working in very close partnership with the Employment Development Department and the local workforce boards as well. And I can tell you about some of the specific efforts we've been working on, and I will tell you that this work has really taken many twists and turns and curves and dead ends, but it's just been really important for us to work closely with our colleagues in other state agencies to find out where we can reemploy people. So I'll go through some of these. You've probably heard about Project Room Key, and this is the effort under the Department of Social Services that is opening up hotel rooms, and the numbers are really increasing rapidly, and to convert hotel rooms for non-congregate housing for people who may or may not be test positive, but who are living with homelessness. And we started working with the city of LA. I will say that some of this work would be easier if there were one state's contract and one state plan, but most of the work on the ground is going to the counties. So we've really been working county by county to understand what the hiring needs will be and figuring out ways to connect people who have lost jobs. And some of this has come down to the way the contracts are written. And so the hotels have been required to provide basic maintenance, basic housekeeping. They are contracting out for security. And so where there have been some opportunities, and I would love to report great success, but we're still working on it, is in some of the kind of light touch case management roles to do some information and referrals, do some daily checks of the people in the hotels. And we've been focusing on laid off hotel workers because some of the skills that people have used in guest services, customer support are just very transferable there. So we're hoping to have some high volume work in LA County that hasn't worked out exactly as we wanted. And in part because, and San Francisco is doing the same thing, instead of hiring new people, is redeploying disaster relief employees of the city and county to do this work. Just to skip down a little bit, we've also been working with some of the hotel conversion for healthcare workers and the state's health corps. You may have seen that a couple of weeks ago, there was a big announcement on the establishment of this health corps. And when it was first being conceived and announced, the Health Services Department was anticipating hiring 13,000 people to work in acute care and just dealing with the surge of COVID-19 patients. Part of what I've been doing is just staying really close to the people at, first got the word out, everything from, getting the announcement on a Cal Jobs system, and working to get the word out to partners in the local workforce boards, local EDD offices, certainly local community-based organization partners, and really quickly called the Chancellor's Office of the community college so that we could get the word out to community college faculty and program directors so that people in their last semester, say, of a nursing program or ideally a respiratory tech program could start getting some work experience. The Department of Consumer Affairs was willing to be flexible around licensing for hiring. Thought we had an opening for DCA to accept foreign medical credentials, and it's ended up that, and this is as of late last week, that because the state has been so successful with stay-at-home orders and flattening the disease curve, that this huge demand for acute care workers really never materialized. And where the push is now is stepping up and supporting staffing at the long-term care facilities where so many outbreaks are occurring. So these are all moving really, really quickly.
Hey, Abby?
Sure.
Sorry, we got a question here about sort of the requirements for somebody returning back to work if they've tested positive for COVID-19. Do you have any sense of what, how employers are making that determination that someone is okay to return back to work?
I don't, but I'm happy to try to get that information.
Great.
Yeah. Making a note for that.
And we actually have one additional question here.
Sure.
Asking about how we can make sure that people who are eligible for financial assistance have the information they need to apply, and recognizing that there may be equity gaps in terms of who understands and is able to navigate the process and who isn't, and whether there are any sort of state-sponsored or other efforts that you know of to help folks with the application process.
Yes, and yes, and I had mentioned a few minutes ago the effort to do outreach into communities who really might not know about both their rights and the income support for which they're eligible right now. I mean, the places where I think people are getting support are certainly through the public system. I know that many of the local workforce boards are shifting to supporting people and applying for benefits. The central labor councils around the state have also ramped up their support for their own members as well as for community people. And I think this is a place where the network of community-based organizations that is closest to the community will be so affected. And, I'll acknowledge that I'm talking to a group of funders, and I think this could be a place where philanthropic support could really make a big difference. But just to go on a little bit here, the state has a panoply of task forces, and I seem to be on many of them really to keep an ear out for workforce and hiring opportunities. And one of those is the testing task force. And I was excited to be on that, and originally thought, great, we can train up an army of phlebotomists to do testing. And then started learning how the tests are actually done. And the, way back of the nasal swab is only doctors and nurses are doing that because there's a gag reflex and people sneeze and cough. And so they have to be doing it. They have to be very skilled, and they have to do that with protective gear on, which, is a whole other challenge. And so the methodology for testing has been, I think, a moving target. The testing task force has been working to get up to, I think it's 25,000 tests a day by the end of April. Cumulatively, I learned this morning, we're just under 500,000 tests, since this started over the whole state. So there's a long way to go. And as you, I'm sure, read, one of the biggest barrier is the lack of swabs and testing equipment. So the state is contracting with two companies, Verily and Optimum, to set up what will be 60 testing sites around the state, the exact location to be determined. And I have been working with different people at the governor's office and Department of Public Health to really understand the methodologies being used, where staffing needs may be, and now working directly with, one of the contractors, Verily, and hope to be working with Optimum soon to find out where their hiring will be, which will likely not be, there will be some healthcare roles, but there will be kind of event staffing roles, people to do support, to take basic information, to do line management, and this just is so rapidly changing. I had heard that now there is technology for drive-in self-administered tests that people can do with their own self-swabbing, and so just continuing to stay on top of that. Many of you may be familiar with one of my favorite organizations, SF Made, manufacturing of swabs has been a real challenge. And so I've connected Kate Sophis from SF Made with people on the testing task force because some of the manufacturing facilities in the city do 3D printing. And so 3D printing of testing swabs could be great, especially for those companies who are hiring people from vulnerable populations. One of the efforts that I'm really spending a lot of time now, which could be amazing if it works out, is contact tracing. And so when you heard the governor speak about the 6 essential conditions for reopening the economy, testing and contact tracing were included among those. And contact tracing is the effort to, for every person who tests positive, to get in touch with that person, to find out the people with whom he or she has come into contact, and then go trace them down, do really health coaching, and it's almost community health worker work to coach people on how they self-quarantine and do some information and referrals on how they can get food and food delivery. And we do not have enough of this. It is estimated that to do contact tracing effectively in California, we would need to really build an army of 39 or 40,000 contact tracers. And so I've been working on this pretty furiously for the last week because this would just be an amazing opportunity to quickly train, and the training can be done really pretty quickly. In San Francisco, contact tracing is being done through the Department of Public Health with 6 hours of training, but the focus there has been bringing in furloughed librarians and furloughed paralegals who have these very sophisticated research and investigative skills. What we're trying to do is focus on those people who have been laid off with transferable skills, customer service, retail. I've heard that bartenders have been really effective at this, people who have high emotional intelligence, who can do problem solving, who will be trained with a very specific script to do contact tracing, and have learned in the last few days that this is a function that is FEMA reimbursable. And so I've been working on two fronts. One is to set up a statewide contact tracing corps that would ideally be hired by the state and then deployed to the counties, because disease control is a function that takes place at the county level. But my own opinion is if we have to go through every county's civil service hiring rules, it will be a long time before this has to move more quickly. And then also working with LA County and a really high capacity labor management organization there, the Work Education Resource Center. Some of you may know Diane Factor, who's been leading that and already doing some very impressive pipeline work with LA County for a variety of workers. But we're working on a pilot in LA County that would start training. It could be up to 2,000 contact tracers there, and pulling in curriculum from the CDC, from work that Diane and her team have already done, and also I have always found to be very impressive curriculum from UCSF Center for Excellence in Primary Care, which trains people for health coaching roles. So that is something that could really go to scale and have a huge impact. I want to jump back to senior meal preparation and delivery. I've been working and this is being referred to as the restaurant feeding program. So we've been working very closely with someone you may know, and I've really been so impressed getting to know Saru Jayaraman, just a tireless advocate for restaurant worker rights, for wage equity and high road approaches in restaurants through the organization One Fair Wage and the Restaurant Opportunities Council. We had been working together on an initiative to reopen restaurants who have had to close and lay off staff, to subsidize wages so that the restaurants can rehire some of their workers to do meal preparation and delivery for, sorry about that. I meant, for laid off restaurant workers. And I'm really pleased to say that San Francisco has taken the lead in that through support from the city, through the Office of Economic and Workforce Development, as well as the Human Service Agency. In the next couple of days, I know Nopalito and another restaurant will be able to shift to community kitchens and rehire between 5 and 10 workers. There is also parallel work that will open up this week in San Diego, in LA, next week looking at Sacramento, and have been working with the Office of Emergency Services, which is launching, and this will be announced by the governor on Friday, a new restaurant feeding program for isolated seniors who will earn up to 600% of poverty level. So they haven't been eligible for the traditional senior meal food program, but they will be eligible now. And the counties this will be administered by the counties through state guidance, and we've been able to work with the Office of Emergency Services so that more than guidance, the rule for the state is that they have to work with 100% new restaurants. There is a strong preference they're being pushed to work with One Fair Wage. When my new friend Ryan Burris from the Office of Emergency Services has his regional calls with the county directors, he will have Saru on that call to talk about One Fair Wage and to encourage the counties to work with these restaurants. And what's really exciting about this is that the restaurants in this program are only selected if they have already committed to wage equity, to high road labor standards and worker protections. They're considered high road restaurants, and they will be, and they have to promise to do this in the future with consequences if they don't. So this is both, this is just win-win-win all over the place, because it is a way to feed vulnerable populations, including, by the way, restaurant workers themselves and their families, as well as healthcare workers, isolated seniors, and then also private pay, which enables the restaurants to get back in business and get some revenue coming in. So just to move on.
Oh, sorry, Abby, we have a couple of questions.
Okay, great.
So one question is regarding the senior meal program, wondering whether you're working with the California Department of Aging on that, given that they have contracts with senior centers to provide senior meals.
So yes, and thank you, should have mentioned that. So it is the Department of Aging that is administering this program. We've been working more closely with Emergency Services, which has been arranging the funding through FEMA and the contracting, but it is being administered by Department of Aging.
Okay,
were there
great.
other questions, Rob?
Yeah, and then another question was for contact tracers, imagining it'd be important to hire trusted community members to work with vulnerable populations. How's the state thinking about who's being hired to work in with community? Yes, absolutely, which is one of the reasons we've really been pushing. And I will say that through all of this, I feel like I'm always kind of trying to elbow out and being in competition with the people from the volunteer services, because it seems that the first impulse is, we'll bring in a volunteer corps, we'll reach out and find retired people who can do this. And Julie and I are just constantly pushing for, well, wait a minute, we've got 3 million people who are out of work. Let's use this as an opportunity to get people working. And yes, it is just going to be really important to have multiple language skills and cultural competencies and connections to the community. Part of what's been fascinating about this is thinking about the remote work aspects, because obviously this work has to be done remotely now. It can be done remotely, but it's going to be really important for people to be of the communities and rooted in the communities where the testing takes place. So they understand the geography, they understand the communities, and they have the language and cultural competencies. Great. Thanks, Abby. And so I know that we also have Terry Feely here with us, and I'm wondering if this is a good opportunity for her to jump in and talk a little bit about the UI expansion work and the implications for low-wage workers. Does that work for you, Abby?
We could do that. I do want to make sure that we have a few minutes to talk about the work in the private sector and then some of the future planning, but
okay, do you want to go there first, and then at the end we'll go to Terry?
Yeah, let me do that.
Okay.
Let me do that. And so we've also been trying to find surge demand in the private sector, which frankly has been, it's all been challenging. But the office, GoBiz, a very close partner agency, has been working with manufacturing facilities around converting to manufacturing test kits and supplies. So the one we've been working with most closely so far is Click Diagnostics in San Jose, and mobilized partnership with the workforce boards in Sunnyvale and San Jose and Southern Alameda County to help Click hire 140 workers to be by June 1st to be manufacturing these, with continuing surge demand, which could lead up to 1,000 workers over the next few months. I will say that doing this work and taking these demand opportunities to the local level has really pointed out some of the limitations in our system. It's the Cal Jobs system, and this could be a whole other webinar that I think we're seeing throughout the state, limits in technology, really using these old legacy technology systems, and it takes a long time. It's kind of clunky for employers to post. It takes a long time to get the word out. so the system that we have for responding really quickly to employers, and when I followed up with Click a couple of days ago to find out how they're doing in hiring, they were confused by all these people who were calling them as much as we've tried to streamline and set up one call. So all this is a good way to kind of look at weaknesses in the system. A couple of the other private sector partnerships, Tim Rainey's really been taking the lead in working with the hotel and hospitality workers, and through Unite Here and the United Food and Commercial Services. And those unions have been working closely together for to make sure that when the large grocery chains hire up, that they're hiring hotel workers. I haven't heard that that's surging success yet, but you know, is a good partnership. And then Tim has also been spending a lot of his time putting together very quick referrals and short-term training in the Central Valley, in Sacramento and San Joaquin, where the grocery warehouses are located and where there have been outbreaks of coronavirus. And so you've got warehouse and grocery workers on quarantine. The other workers are working overtime and really getting you know, burned on. And so there's a huge need to hire. So those kind of labor exchange and quick training are moving very quickly. I talked about the restaurant feeding programs, and the U.S. Postal Service is hiring, and you could just see those surges in demand with more people ordering deliveries, and have been working with U.S. Postal Service recruiters in the Bay Area and LA to do online webinars and application workshops so that they can be hiring up.
Abby, we got one other question about the restaurant feeding program, wondering whether
Sure.
some of the nonprofits that operate commercial kitchens are included in any of those opportunities for partnership to help keep kitchen staff at nonprofits paid and working.
You know, at this point, the partnership has been with the private restaurants. We have heard, though, some communities that are already working with nonprofit kitchens and prefer to keep working with them. So not a formal connection at this point. Just to wrap up, because, you know, in this whole crisis, there is opportunity, and wanted to just talk a little bit about how we're looking at the future. One of the task forces that's really been exciting to work on is this Future Opportunities Task Force. And the work has split into kind of two branches. One is looking at government resiliency. What is the state itself seeing in moving all these people to remote work, some of whom were sent home with computers without cameras, and you know, just looking at ways that the state can grow from this and adopt management practices and remote work practices, and in ways that it hadn't before. The other branch I've been more involved with, and it's really, we've been looking at both projects to kind of put a priority list together for the governor's team in the event of, and I know that we're all optimistic, but there will be some significant stimulus funding probably coming out in the early fall, and that these will likely focus on hopefully large infrastructure projects. And I've been working on a set of criteria so that we don't have 100 different little workforce programs, but we have common principles around infrastructure projects that ideally would have a few percentage points of their funding going to training. And what I'm pushing for is real pipeline training with an equity lens, so that people who wouldn't be Hammer ready would really have a chance to build literacy skills, readiness skills, pre-apprenticeship, apprenticeship, so that this can be a true pipeline program, and then to have some transition planning at the end. And also building in labor standards, job quality standards, so that every one of the projects that is hopefully funded is doing this from a high road perspective. Just really briefly, I had mentioned earlier that I was brought on to support the Future of Work Commission, which was about and will submit an interim report to the governor by May 1st, but given the pandemic is on pause right now because, as we had said, the future of work just came upon us really suddenly and really quickly. And so the commission itself is on pause. It will, when it reconvenes, it will be kind of rethinking some of the findings and recommendations given what we've learned in the pandemic. And then, as I'm sure you all saw, last Friday, the governor announced a new task force on business and jobs recovery. And there is overlap with the co-chairs of the Future of Work Commission, with Secretary Sue, a few other members of the commission, and we just really want that work to be well aligned and coordinated. And as I just mentioned, really using this as an opportunity to see how we can build a truly high road public workforce system that can, build on the success we've had with the high road training partnerships, the high road construction training, and really be investing in skills for good quality jobs, and also continuing to shift to more virtual strategies and online strategies. So lots of trying to respond now and also looking ahead to the future. So let me pause now. And Terry, this may be a good time to talk about some of the benefits. We can also, I know we just have about 10 minutes, Rob can also answer some more questions.
Yeah, so we have one more question, and then maybe we can turn to Terry, and we'll break it at 5 before the hour to do some wrap up. The last question is, what role are community colleges playing to fill critical hiring needs now and prepare students and workers for future needs?
Well, I certainly had mentioned the recruitment for the healthcare through community colleges, I see the role. I would say that I haven't had much more contact myself with the community colleges. I see just tremendous opportunity, though, as we work our way out of this, for training that aligns even more to where the economy is going. If we can pull off the contact tracing program, I would love for us to be looking at that as a career pathway program in healthcare. And then, we would have thousands of people who don't have experience in healthcare now having these entry jobs. And I think that could be a tremendous role for the community colleges for those folks to go into career pathway training in nursing and allied health and in public health roles to really build careers in healthcare.
Great. So Terry, do you want to jump in for a few minutes here? Oh, I think you're on mute. Let's see. Kyla, I don't know if there's a setting that we need to shift here. Gonna try again, Terry? Shoot. Okay, so Kyla sees if we can work out that technical challenge. One other question that we did get at the beginning that we didn't circle back to, Abby, is around, you mentioned that 3 million jobs were lost, and there was a question just for context about the number of workers in California in total, so we can kind of frame that 3 million number.
Well, I should know that, and I don't have it at the top of my fingertips. I know the total population is about 40 million. And, if the workforce is 2/3 of that, you can work backwards, but it's a lot of people who've lost jobs, but happy to get that.
Okay, great. And we can send that out afterwards. And then the other question was sort of related, which was data on the impacts in terms of employment on people by race and ethnicity and gender.
Well, I don't have those numbers at my fingertips, but you can kind of back into those. if you look at the sectors that are, that saw the most layoffs early on, and those are, hospitality, restaurant, retail, other services, and those are areas that have a high proportion of workers of color and women. And so we know that the impact on communities of color and women is larger than it is on the rest of the economy. And it's been kind of interesting to me, having lived through the 2008 recession in San Francisco, where the multiplier effect really went from the tech sector and the business professionals who lost their jobs to the places where they had lunch and stayed in hotels. Those were more secondary. I think what we're seeing now is starting to see layoffs in the tech sector, especially in San Francisco, with those companies like Yelp, like Eventbrite, that have relied on restaurant revenue for their company. So it's almost working reverse in a reverse way.
All right, great. Well, so we're about 5 minutes out, so I think we're going to shift to wrapping up. And I've just asked Terry in the chat if we can share some information out about what she was going to talk about today afterwards. Abby, thank you so much for joining us today. I know from our past conversations that it's we all think we're busy, and then I talk to you, and then I get a sense of what busyness actually looks like these days. So thank you. And to all the attendees, we will share out the slides for this afterwards. And Kyla, if you can advance to our last slide. And we'll also find and share out some information about, in response to Jeff's question about the number of workers in California with race, ethnicity, and gender data in terms of employment impacts to the extent that that's available. So as we wrap up, I just wanted to share a few exciting updates from Rework the Bay coming in the next month. So Abby mentioned there's some statewide relief efforts underway, both with the governor's administration and a private philanthropy fund run by grant makers concerned with immigrants and refugees. Rework the Bay is going to be pulling together a 9-county collaborative effort focused on establishing a Bay Area undocumented cash relief network in partnership with the relief funds that have already been established, really wanting to make sure that all undocumented workers in all 9 counties of the Bay Area and their families have a way to access safely and efficiently cash relief in times of crisis, which includes the current COVID-19 pandemic, but we see this as something that can be beneficial in the future as well. So we'll be sharing more information about that effort soon. We also will be releasing 2 reports in May that may be of interest to you all. The first is called Reimagining a Bay Area Workforce System Grounded in Equity. It's a project that was done for the collaborative by the Insight Center in Oakland. And it looks at the history of the Bay Area workforce system, both from policy, practice, and narrative perspectives through a race and gender equity lens, and offers some recommendations to make the workforce system more responsive to the needs of job seekers of color and women. And then the second report is actually a report and a framework to help Bay Area decision makers understand better how the nature of work is changing in our region. And arguably, a lot of the changes we saw pre-COVID-19 crisis will probably accelerate or may accelerate in the coming months. And so this will be an important report for us to understand through a worker-centered lens how work is changing and how we can look at new initiatives coming up around the future of work to make sure that they're meeting the needs of the most vulnerable workers in our region. That's a project that's being led by Working Partnerships USA and Jobs with Justice San Francisco. If you would like any additional information about any of those projects or any of the topics that came up today, feel free to reach out to me. My email address is there. We also will share out Abby's email. I know she offered to make herself available afterwards as well. And with that, I just want to thank you all again for joining us today, for taking the time. I know we're all a little webinared out, so appreciate you all joining us, and looking forward to staying connected. And also, if you have any additional ideas for future webinars, please do let us know. All right, stay safe and healthy, everybody. Stay connected, and we look forward to talking to you again soon.